I've got the actual prescription testosterone itself.
Ben is one of a growing number of men injecting testosterone every week.
This has been game-changing for me, and I wouldn't change it for the world.
Many say this drug has changed their lives, but some of Britain's top doctors are worried.
It causes high blood pressure, it makes your cholesterol worse. I've got no doubt that if everyone took it in the world, then you would actually hasten the demise of many men.
Masculinity is the resistance.
Is social media convincing men that testosterone levels are key to understanding masculinity?
If you weren't getting tested and you weren't taking testosterone replacement therapy, that you weren't this real man.
Others say this is a condition long under-researched, one finally getting the attention it deserves.
The best single indicator of a man's health is his testosterone level.
So is testing and treating our testosterone levels really the key to improving our health? Or is the wellness industry selling men solutions to a problem that, for many, doesn't actually exist? I've spent weeks speaking to men across the country about their testosterone levels. I've met those both trying to treat them and those trying to sound the alarm.
That is my suppliers. So I've got the actual sort of prescription testosterone itself, which, as you can see, there's not a lot left in there.
Ben is 33 and has been taking testosterone replacement therapy, or TRT, for 4 months. He pays over £120 a month for the private prescription. Unless additional drugs are taken, TRT can cause infertility by reducing sperm count. And as the drug stops the body naturally producing testosterone itself, Ben will have to take it for the rest of his life if he wants to keep his levels stable.
When taking something like this on, you have to really change certain aspects of your life, because you've got to get used to injecting yourself once or twice a week. You've got to be aware of the commitment of having all the suppliers, you know, even as far down as having a blood pressure monitor.
But worth it for you?
100% worth it.
Testosterone is the primary male sex hormone. It contributes towards muscle size and bone strength, sperm production and sex drive. Some men struggle to produce enough testosterone naturally, and in others it reduces with age. Not having enough can cause erectile dysfunction, a loss of libido and muscle mass, as well as tiredness, a lack of energy, and even depression. But along with those symptoms, there's a disagreement about what blood test results could count as low testosterone. The NHS suggests that having around 8 nanomoles of testosterone per litre of blood could indicate a low level. But the British Society of Sexual Medicine goes higher. They look for around 12 nanomoles of testosterone per litre of blood, and some private providers will look for a level of 15 or below to start prescribing replacement therapies. We've come to a small village just outside Edinburgh to meet Richard.
So this is my home setup.
A 43-year-old who started using TRT at the beginning of 2026.
You went on to TRT in January.
Yes.
So to start, I just want to take you back a few months before that. What was life like in, say, November last year?
Pretty miserable, to be honest. I didn't feel like myself at all. Mentally, I just felt drained all the time. I didn't have any energy to do the things. I actually found myself not wanting to do things that I enjoyed doing.
Blood tests revealed Richard's testosterone level was significantly higher than the threshold at which the NHS might have considered treatment. But after lifestyle changes didn't alter his symptoms, he decided to start on TRT.
My motivation to train has come back. My motivation to do things that I enjoy has come back. I don't have the brain fog, and I think that's kind of the main thing that I've noticed that's changed. The main downsides are that obviously you need to inject yourself 3 times a week, and if you want to continue feeling that way, you have to do that for the rest of your life.
You chose to come off the kind of additional medication that helps preserve your fertility.
Yep.
That's a big decision, isn't it? It's a big moment.
Yeah, but I think I've been comfortable with my decision on not to have children for a long time, much to my mum's upset. But yeah, upset my mum a little bit on that one. But I mean, the other downside of coming off those medications is that it does actually shrink your testicles as well. Something that I think most people only really associate with bodybuilders who are kind of taking large amounts of testosterone. But if you do take testosterone without those additional drugs, it does shrink your testicles. Whether or not that bothers you, I suppose, is purely personal.
It was really interesting speaking to Richard, and I think he's somebody that if the NHS saw his blood test results, they probably wouldn't prescribe him the medication he's on. But the way he sees it, his symptoms weren't getting any better. He went to a private clinic and got testosterone, and that, in his words, has been a game changer. But some senior doctors believe too many men are unnecessarily worried about their testosterone levels, and believe too many are being prescribed medications that can have an impact on their long-term health.
It serves no one any good to have men who have severe testosterone deficiency being undertreated. But on the same side, I think we can't lurch to the opposite and have populism trying to promote testosterone as the elixir of life.
Channa says social media content means more men are experiencing symptoms like tiredness or low mood and attributing them incorrectly to low testosterone.
The problem is nowadays that men are being prescribed testosterone by certain clinics, particularly in the private sector or online, when they have very non-specific symptoms. All medications have risks, and if you give testosterone to every single man, what you will do is cause immense harm. So it causes thickening of muscles, including the heart, it causes high blood pressure, it makes your cholesterol worse. And I've got no doubt that if everyone took it in the world, then you would actually hasten the demise of many men.
And you can probably feel your testosterone levels surging as we enter the gym right now.
So could the turn to testosterone be an example of the stresses of modern life being medicalised? And could modern life itself be the very thing that is turning us towards medication? At this boxing gym in Gloucester, Edward, a coach and lecturer in sports science, certainly thinks so.
The market is a wonderful thing that's brought us many advances in science and medicine, but it's fundamentally amoral. It'll sell you cigarettes, it'll sell you drugs, it'll sell you testosterone if you let it. So what you've got to do is have personal agency and take responsibility for your health and your lifestyle and your environment.
What are the issues you see with TRT then?
You must consider, if you're going to take out an expensive prescription in your 30s or even 20s, we're hearing now, can you do that for the rest of your life? There's a bigger problem though, and I would call it part of this transhumanist impulse to transcend our biology and fight the physical limitations.
But if lifestyle changes aren't enough or aren't realistic, there is a large private health and wellness market that men can turn to, and it's growing rapidly.
So you lose part of your identity if your testosterone drops.
Voi provides testing and treatment for low testosterone. It regularly advertises testing services using celebrities on social media.
Look, when you find out your testosterone level is 3, it can be very shocking.
Adverts which focus on the symptoms like low mood and tiredness that Voi says could be indicative of low testosterone. We've just arrived at the London offices of Voi. They describe themselves as the biggest provider of testosterone to men in the UK. They're really leading in this field, so we're quite keen to speak to their Director of Men's Health to find out what exactly is driving that massive surge.
The best single indicator of a man's health is his testosterone level. Now, it doesn't necessarily mean you need testosterone treatment, but it will tell you how healthy you are because it's affected by so many other things.
Jeff Foster is a doctor, author and podcaster who believes testosterone is key to understanding men's health. Doctors I've spoken to say that the kind of most obvious sign that somebody has a genuine testosterone deficiency would be things like loss of libido, loss of sexual function. Why in a lot of your adverts are you choosing to focus on things like anxiety, depression, rather than those physical symptoms?
The simple answer is not all patients with low testosterone have to have sexual dysfunction. So guys may use that as an indicator, but it certainly shouldn't be the only factor. And if you only target sex drive, we are going to miss a large number of men that will have low testosterone but never thought of getting it tested.
As a cynic, might say you're focusing on things like tiredness, anxiety and depression because that's something we all experience and that's going to drive more people to buy your products.
The more people that get tested for testosterone, the more we are going to find people with low testosterone. Now that doesn't mean they're going to get treatment. In fact, 93% of our patients that get a test don't end up on treatment.
We also put Dr. Channa's concerns to Voy. In a statement, Dr. Jeff said, "Those risks are real when TRT is overprescribed and poorly monitored, but that is not what proper treatment looks like. Guidance calls for 1 blood test a year. Voy does 2, precisely to catch any issues early. The largest ever trial into testosterone, Traverse, found that TRT used correctly does not raise the risk of heart attack or stroke, and several studies show it can actually improve cholesterol and blood pressure at the right dose."
Set up your lifestyle so that they kill testosterone, which makes you weak and ugly.
Some researchers are concerned that the online manosphere is linking low testosterone to a broader crisis in masculinity.
We found these really strong narratives that, it was essential to have these kind of optimal testosterone levels, and that if you weren't getting tested and you weren't taking testosterone replacement therapy, that you weren't this real man.
Masculinity is the resistance. If you want to take back control of your life and look after the people around you, you need high testosterone.
For her research, Brooke analysed 46 social media posts focused on testosterone, which reached almost 7 million accounts.
It's really being promoted at those kind of younger, healthy men and normalizing everyday life experiences like being tired, potentially not wanting to go to work, lacking drive, things that we feel from time to time. That is where it becomes quite concerning and really in the pursuit of profit rather than wanting to help men who genuinely need it.
Is leaps and bounds.
Back in Gravesend, I was curious to ask Ben his thoughts, if TRT, despite its costs and commitments, had been worth it.
There might be some people who would say, in all of those 3 blood test results, your levels were above what the NHS would class as low testosterone.
Yes.
How does that make you feel?
I personally think that the NHS have very strict guidelines on the prescription aspect of TRT. Obviously, there are a lot of people that maybe are looking to go on to TRT even if they don't need it. And I think they are very much concerned about a number, whereas clinics will focus on the number, but also how you feel, your symptoms, your well-being. My whole life it feels like has turned around from where I was, 4 or 5 months ago to now. It is the polar opposite of where I was. I have so much more energy. I've got more focus at work.
Online and offline, questions are being asked about low testosterone, what it is and how it should be treated. Is private healthcare responding to a condition that has, for years, been underdiagnosed and undertreated? Or is it instead helping to create the very demand that drives its profits?